When we think about surgery, all the focus tends to be on the surgeon, right? Their skill, their hands, their reputation. But what if I told you that one of the most critical factors for a successful recovery is something you actually have a ton of control over? Yeah, today we're exploring the incredible hidden link between what you eat and how well you heal.
So let me just pose this question. What if the biggest risk you face in a major surgery isn't the operation itself, but how you're fueled for it? Think about that. This is a huge deal because being malnourished isn't some rare condition. It's a widespread and honestly, an often invisible problem for so many patients heading into the operating room. All right, let's pull back the curtain and look at the stark reality of this hidden toll. The data here is, well, it's pretty eye-opening. Okay, brace yourself because these numbers are just staggering. For malnourished patients, the risk of infection is almost 4 times higher. The risk of other complications, also nearly 4 times higher. But this last one, this is the one that really gets me. The risk of mortality is over 7 times higher. We're not talking about small margins here. These are massive, flashing red warning signs. And don't think for a second this is some niche problem. We're talking about up to half, that's 50% of all orthopedic surgery patients being malnourished. That means 1 out of every 2 people is walking into a major operation already at a huge disadvantage. And the craziest part? Most of them have no idea. So the big question is, why? Why is being malnourished so incredibly dangerous when you're about to have surgery? Let's get into the science of it because what happens inside your body when it goes on the defensive is both fascinating and a little bit scary. It all comes down to something called the surgical stress response. See, your body perceives surgery as a major trauma and it reacts by flipping a switch into what's called a catabolic state. Basically, it gets so desperate for energy to deal with the stress that it starts breaking down its own muscle for fuel. I mean, think about that. It's like your body is demolishing the walls of its own house just to keep the furnace running. It's a survival mechanism, but man, it comes at a huge cost. And here's a perfect example of exactly what's at risk. These are the paraspinal muscles in the lower back. They are absolutely crucial for stability. After a big surgery, like a spine operation, they're incredibly vulnerable to atrophy, which is just a fancy word for wasting away. And let me be clear, this muscle loss, also known as sarcopenia, isn't just some minor side effect. It is a major complication that can lead directly to more pain and long-term disability. Okay, so we've laid out the problem, and it sounds pretty grim. But here's the good news. We can absolutely fight back. There is a solution. It's a proactive nutritional strategy that can completely change the game. And that solution has a name: perioperative nutrition. Now, this is not about just eating a healthy meal the night before. No, no. This is a full-on science-backed game plan that covers the entire surgical period, before, during, and after. It's all about strategically fueling your body to handle the stress and to supercharge your recovery. So how does this game plan work? Well, it's broken down into 3 pretty simple but really powerful phases. First up, nutritional screening. You gotta identify who's at risk before they even get to the operating room. Second, pre-op fueling. This is where you load up, building your body's reserves with things like high-protein drinks and carbs. And finally, step 3, post-op rebuilding. You start getting nutrition back into the system as early as possible to stop that muscle breakdown in its tracks. Now, in this whole nutritional game plan, if there is one MVP, one most valuable player, it's gotta be protein. Let's dig into the evidence because the case for why it's so critical for rebuilding your body is just incredibly powerful. And this quote from the International Journal of Spine Surgery really just says it all, doesn't it? The important role of dietary protein in minimizing this complication has been overlooked. It's been hiding in plain sight this whole time. This isn't some new wellness trend we're talking about. This is a fundamental, often missed medical necessity. And here is the proof in the pudding. Look at this study. The group that got protein supplements, the intervention group, they either kept their muscle mass or, get this, even built some. Meanwhile, the control group, who just got a placebo, they lost muscle mass. The difference is just, it's crystal clear. So what did this actually mean for the patients in the hospital beds? Well, the results were incredible. We're talking significantly less muscle wasting, which led to significantly less pain after the operation, and you guessed it, significantly less disability during recovery. It just goes to show you how a relatively simple nutritional change can have a massive impact on someone's quality of life. And it's not just about what the clinical data says. The patients themselves feel the difference. In another study, this time with joint replacement patients, nearly 80% of them were satisfied with their nutrition program, and two-thirds were convinced it actually improved their recovery. That's huge. It shows that patients feel more in control, more empowered by this approach. So, with all of this compelling evidence, you'd think this would be standard practice everywhere, right? Well, it's not. So let's talk about the real world challenges. Why isn't this happening across the board? And more importantly, what can we actually do about it? This is where it gets really fascinating because there's this huge disconnect in perception. The people who actually did the nutrition program, almost two-thirds of them felt it improved their recovery. But the people who opted out, almost 90% of them assumed their recovery would have been exactly the same without it. It's a classic case of you don't know what you're missing, right? You just can't appreciate the benefit until you've experienced it. So, what was the biggest barrier holding people back? You might think it was skepticism, but it wasn't. The number one reason patients gave for not participating was simple: cost. $150. For a program often not covered by insurance, that was just too big of a financial hurdle for many to overcome. Okay, so the most important point here is putting all this knowledge into practice. And the experts have laid out a really clear roadmap. It's about screening every single surgical patient. It's about using a 1-2 punch of exercise plus nutrition. It's about making high protein intake a priority. And it's about starting nutrition again as soon as humanly possible after the operation. This isn't guesswork. This is the evidence-based gold standard. And that really brings us all back to you. Because at the end of the day, you have to be your own best advocate. The science is undeniable. Nutrition is an incredibly powerful tool that you can use to improve your own surgical outcome. So after everything we've talked about today, the final question really is for you. What will you ask your doctor about your nutritional game plan?